So a couple of comments on neoadjuvant therapy. There's a lot of interest in this, as we said. It's a standard approach, quote unquote, in the setting of borderline resectable pancreatic carcinoma, and stems from the high risk of systemic failure, the ability to avoid a surgery for patients who declare themselves with systemic disease. We know that also a significant group of people who do undergo surgery are not well enough to be able to receive adjuvant therapy in a timely way. And that means that theoretically, neoadjuvant therapy may get more modalities of treatment, be it systemic therapy, be it radiation or surgery, into more people, and that in of itself could improve outcomes. And there's some data, certainly when radiation is included, that margin negative resection rates and lymph node retrieval rates and lymph node positivity rates are less. And I think with modern cytotoxic regimens, there's evidence that we can truly downstage some patients. The con, of course, is that we may lose the ability to successfully resect patients. That, in my opinion, speaks to biology and probably not the treatment per se. And that individual who demonstrates early disease progression probably would not have benefited from an upfront surgical approach in the first place. So speaking to recent data, the PREA-PANC-1 trial was presented at ASCO this year, and this looked at a neoadjuvant chemoradiation approach compared to a traditional surgery and adjuvant gemcitabine approach. And I'll just point out here that the treatment was essentially single agent systemic therapy, right? So not what we recommend or use. But the point to note is that it really does support the notion that a neoadjuvant paradigm may have value for patients. So in this trial, and it's a preliminary analysis, there was a clear hint that patients who received neoadjuvant therapy had an improvement in outcome. So this question really needs to be asked and answered with modern day combination cytotoxics, and those studies are being planned at this time, and similarly for disease-free survival.